This is Dr. Abdul Rahman Hakeem. I'm a consultant transplant surgeon at Dr. Rela Institute and Medical Center. There are three common ways of pancreas transplant. One is implanting a pancreas along with the kidney transplant, which is called as a simultaneous pancreas and kidney transplant. The second thing is basically somebody who's already had a kidney transplant and we implant pancreas in them. And the third one is where we transplant pancreas alone. Let me just give you a sort of understanding of these three types of pancreas transplant. Now, for the simultaneous pancreas and kidney transplant, which is where we transplant both the pancreas and the kidney, this happens in about 2/3 of the patients. We do both the transplants. So one of the main indications for pancreas and kidney transplant is patients who have got diabetes and have had progressive damage to their kidneys and either have already started on dialysis or nearing dialysis. So for these patients, what we do is that we make a cut in the center of the tummy and we implant the pancreas first, which is behind the right bowel, and then the kidney gets transplanted through the same incision into the left side of the tummy. So this basically gives them relief both from the diabetes and also from the kidney failure, and this is basically the commonest reason for pancreas transplant. The second thing is where we do a pancreas after a kidney transplant. This is for those, for example, somebody has already had a kidney transplant because of the kidney failure and they're diabetic and they want an utmost sort of full control of their blood sugar so that their new kidney does not get damaged with the diabetes. Then we do a pancreas transplant after them. So it's basically pancreas after a kidney transplant. Third one, and the most uncommon one, is where somebody gets a pancreas transplant alone. For example, somebody has got very erratic blood sugar control and gets problems because of either hypoglycemia, where the blood sugar is very low and they are not aware of it, and these people can either get a fit or they can get a very sort of accidental injury because of sudden fall from low blood sugar, or they get very high blood sugar. For these patients, we can do a pancreas transplant alone. But however, this is not a very common reason for a pancreas transplant.